Hi, good morning Nico. My name is Alice Schofield. I'm your invigilator for the OET speaking session on the 26th of June 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Nico Corner.
And what is your candidate number, please?
My candidate number is 253142003.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Thank you. So let's start with warm-up questions. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Tell me about a time when you had to do something difficult. How did you handle that?
I've always wanted to learn a second language. Thus, I started attending English classes when I was in high school and wanted to continue that in college. Turns out in college, things were a lot more difficult than high school. I was struggling with the language, so the summer of my sophomore year, I went to Canada and worked at a restaurant. That was a turning point. I learned that, if you want something badly enough, you can always find a way to make it happen. I bring the same attitude to my work as well.
What do you do when entering a patient's room?
First, I knock to let the patient know I'm at the door. Initially, I would introduce myself and convey the purpose of my visit. Moving forward, I will try to build rapport with the patient by finding something in common with the patient. Hence, we can get to know each other and feel much more comfortable in communicating. I always greet the patients and ask if they need anything, even if they aren't capable of responding.
Give me an example of a time when you struggled to communicate something to your patient. How did you manage to get your message across?
Working as a nurse, I deal with people from all walks of life and across a range of different socioeconomic profiles. I've learned that there isn't a single way to communicate with people, and that I have to adapt my style to suit the different patients. For example, I may have patients who are less literate, for whom I need to explain things in very normal language. But those who are much educated can understand easily. Also, there are patients who are very much upset and worried. So, when communicating with them, I may have to explain things multiple times due to lack of their attention. Thus, I have developed my own skills and can handle a wide range of patients.
A patient is in severe pain, but the attending physician states nothing is wrong with the patient. What will you do in this situation?
As a nurse, we are taught that pain is subjective. If the patient perceives, it does not mean the pain is not there. There was a reported similar case when a patient died due to extreme pain because the nurse disregarded his complaint. However, careful assessment is still required. I will perform the necessary pain assessment using a pain scale rating to quantify the level of pain the patient is experiencing. I will correlate this to his or her chart and look thoroughly at his medical history to trace the source. Also, to safeguard the hospital against issues with dispensing controlled substances, I will also assess for depression, alcoholism, and possible substance abuse.
What do you contribute to your patients?
I want my patients to have the best experience possible, and I consider that my sole responsibility. I will go above and beyond to see to it that my patients are well taken care of. I believe dedication is an integral part of being a successful nurse and providing the best care under any circumstances. Also, I offer a listening ear that they can feel comfortable confiding in. As well as knowing, I will wholeheartedly advocate for them, if necessary.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the roleplay. You will start the roleplay after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the roleplay card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good morning. My name is Nico Corner, one of the registered nurses working in this clinic. How may I address you?
Good morning, nurse. My name is Alice Schofield. And you can call me Alice.
Hi Alice, how may I help you today?
Nurse, I think my son has caught some virus infection. I need your assessment.
Just be calm Alice, relax. We will definitely help you in this situation.
Okay, please nurse.
Sure, could you please tell me the name and age of your son, for the records please?
His name is Jack Schofield, and he is 18 months old now.
Thank you for your information. Well Alice, may I know the reason why you think your son Jack has caught the virus?
Actually nurse, Jack is usually a very contented baby. But he has been crying and fretful for the last few days.
Okay, noted Alice. And did he show any symptoms of virus infection?
Yes nurse, he has had difficulty sleeping, and keeps dribbling, and chewing on his fingers. He also has a mild fever nurse. That's why I wonder whether he has caught a virus.
All right, I acknowledge your observations. For confirmation, let me summarize what you have said.
Okay, nurse. I'll check on you.
Alice, your son Jack, who is usually a very contented baby, has been crying and fretful for the last few days. He has had difficulty sleeping and keeps dribbling, and has started chewing on his fingers. He also has a mild fever. Am I correct?
Yes, nurse. You are right.
Now, Alice, I would like to have a quick examination on Jack, please.
Sure, nurse. You may please proceed.
Thank you for your consent, Alice. Based on my examination, I can find his gum is inflamed, and he is cutting his first molar tooth.
Oh, really?
Yes, Alice, it might be the reason behind his discomforts.
Is it, nurse?
Certainly, Alice. It is quite normal that babies will be in mild pain and feel fretful as they experience the cutting of their teeth.
Okay. So there is nothing to be alarmed about in his current situation?
Yes, you are correct, Alice. All the symptoms you have noticed are commonly seen in babies during this stage. Therefore, Alice, please be worry-free. Also, I reassure you that the teething problems will usually settle quickly.
That's fine, nurse. If this is the cause behind his conditions, then it's okay.
That's perfect. Well, do you have any other concerns to be addressed?
If you can suggest some remedies to make him settle when he feels discomfort, it will be very helpful.
Unquestionably, with pleasure, Alice. I will guide you through the same.
That is so kind of you.
I am glad I can share my knowledge with you, so as to care for your son. Kindly follow my suggestions to ease his pain.
Okay, you may please.
First of all, you can contact the chemist about a recommended teething gel to massage into the gum. This will help Jack to settle his fretfulness and make him feel much more comfortable.
Okay, surely, I will get it from the chemist and massage Jack's gum with it.
Good to hear that. In order to avoid chewing on his fingers, you can provide a teething ring that is kept cold in the refrigerator, or else you can give teething biscuits and a piece of apple to chew on.
That sounds good, nurse. Definitely, I will try them.
Awesome. Alice, to relieve his pain, you can give a recommended dosage of baby paracetamol mixture, as necessary.
Okay, I understand that, nurse.
Thank you for accepting my suggestions. Do you need any other clarifications?
No, nurse. It was all I needed to know, at the moment.
All right, I am happy I could help you today. If you have any other concerns, always feel free for further queries.
Sure, thank you. That is the end of your OHE speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.